wars, politics,
fame,
discrimination, bigotry, bombs,
crime,
incest,
abortion, rape,
hypocrisy,
drugs,
talk
adultery,
shows,
seduction,
child
murder,
racism,
blood with teenage pregnancy, discrimination, domestic
Recovery Mentoring Program was given birth in 2007. Reason being is that there's a lack of resource and a lack of support and case management within the community. And we feel it necessary, and we feel that it's our duty, and we are obligated to provide a compassionate, effective, loyal service to the crisis population, which consists of 7 programs. The elderly, we'd like to extend ourselves to the past generation, where we take them to their doctor appointments, take them grocery shopping, and also provide companionship and home care so they can be safe and they could be nurtured and they can be looked after.
Being aged and being disabled is a very painful experience in my outlook. I think that when you're growing old, it's a lot to cope with. But when disability is being added to it, it makes it almost impossible to cope. You are left open to unscrupulous people. They try in every way they can to befriend you, to take advantage of you financially and otherwise. People who are in this situation suffering with things like Alzheimer's, they are at a greater disadvantage because they don't really know, some of them, who they are, where they are, and they need desperately caring, thoughtful, loving individuals around them to help to supply their needs, because our needs, disabled people's needs, are very different. They differ in many ways depending on your disability. Most times you might need someone to give you a shower or a bath. You need someone to take you shopping if you are able to shop. You need someone to clean up for you because you are not able to do so for yourself. Our needs are so multiple. There are so many. It's difficult to really express in words all the needs of seniors, especially disabled ones.
Now, the second program is HIV.
There is a great need in our community to help those who have been infected with HIV and AIDS. And in our community and state, we have a great number of people who require services of the health department and also mental health services. We hope to provide those services through spiritual guidance, through assistance and mentoring, and through trained caregivers. As a mentoring organization, we want to reach out to those who have been diagnosed with HIV and AIDS and help them to seek treatment and help them to understand the resources that are available to them in our community. In the city of Orlando, we have Title I government funds available to people for treatment, as the antiretroviral medications can be very expensive. So we can assist people with financial difficulties, we can assist people who have housing difficulties, as well as family difficulties throughout this time. As the diagnosis of HIV and AIDS inflicts people, they sometimes become depressed and consider suicide as an option. And through mentoring, we can help to treat people for depression. We can also help to understand and help those with adjustment disorders, with panic attack, with a wide variety of mental illness that comes secondarily to a diagnosis of HIV and AIDS. And we can also help them to live with their families and to maintain a hopeful state of mind, in that the medications presently and in the future are helping more and more for people to live very productive and functional lives. If the situation arises that death is imminent, as mentors, we can also help those people to understand the dying situation and to help them pass in a peaceful manner. Also helping their family through guidance and counseling through this difficult time. Statistically, the number of people infected with HIV and the AIDS virus is up to 1.2 million in the United States alone. 25% of those people don't know they are infected. In the Recover Mentoring program, we hope to encourage people to test for HIV, AIDS, and then follow up with treatment. One of the roles of the mentor or the health aide will be to help educate people and encourage them to seek resources, educational resources, health resources, and funding resources to help in the living with this illness.
As I walk upon this earth, I will fear no evil. No, the Almighty One is near. Give thanks and praise for the blessings I've received. Looking around the world today, there's nothing but despair. People say they understand, but they don't really care. Knowing what we know, we turn and walk away. Not trying to make no changes, 'cause life can be unfair. Brothers and sisters, I'm not preaching, I'm trying to get along, but it's not reaching. With the teachings we must go forward, that's the way it's supposed to be. Blessed are we chained or trapped, living by the word. That's the only way